Kalispell Regional Health Center has really ramped up its cardiac care. And since the inception of these new services that kicked in 2016, the clinic has now grown and continued to thrive, adding more vital heart procedures every year.
MTN's Jack GINSBURG shows us how the most recent edition of a heart procedure will help patients all across western Montana.
The Rocky Mountain Heart and Lung Clinic, run here at a Kalispell Regional Health Center, provides cardiac and pulmonary care to those in the Flathead Valley and beyond. The clinic recently just added another heart procedure, rounding out the list of nearly every FDA-approved heart procedure offered here at the hospital.
The new procedure helps those with atrial fibrillation, also known as AFib, a condition that causes the heart to beat irregularly, heightening the patient's risk of stroke by 5 times. AFib is the most common cause of stroke worldwide.
Currently, we have around 20 million people living in the United States who are at risk for atrial fibrillation, and about more than 80% have atrial fibrillation. And it is estimated that by 2050, the population of atrial fibrillation will go up to as high as 40 million.
The procedure runs a catheter through the femoral vein in the leg, going up to the outward patch of the heart where the blood clot has occurred. An umbrella-shaped device called the Watchman is put into the back of the left atrium, allowing the patient to have a permanent stroke prevention device.
And this is what we put it inside the patients, and it comes in various sizes. And depending upon every patient, we choose that particular size and we put it in. And once it is in, the body forms the tissue over this device. And once the tissue is formed, then we can stop the patient's blood thinner for life.
Before the Watchman was invented, many people took blood thinner to reduce the threat of stroke. However, a lot of patients' bodies can't handle that form of treatment.
10 to 15% of patients can't tolerate blood thinners. They bleed, they bruise, bloody noses are very common, and these can be life-threatening for them.
And if blood thinners didn't work, the hospital would have to regress to less effective methods, such as aspirin.
Some people can't even tolerate that, and they're just a walking stroke risk, which is a horrible situation to be in.
In the past, those patients would typically have to seek medical attention in a different state until now.
We used to send out people for pacemakers and procedures such as this to either Spokane, Washington, or Utah, Mayo Clinic. Patients in Montana can now stay here in Montana and get the same procedures at those major centers.
Jack GINSBURG, MTN News, Kalispell.